Today, we're diving into psychopathy, risk assessment, and how we manage dynamic risk factors in a disorder that doesn't exactly like to change. Basically, the goal is to focus on what we can control rather than the things that we can't, which is roughly half the disorder. So, first up, what do I mean when I say that the disorder doesn't really change? Well, it's a pretty static disorder, meaning that it stays relatively consistent throughout the life course. In the DSM, ASPD is described as becoming less evident or remitting as the individual grows older, particularly by the fourth decade of life. They're not saying this because people just stop being psychopathic. They're just saying this because psychopathy is much less common in an older population. This is because psychopathy is highly correlated with risk-taking behaviors. This means in midlife, people with psychopathy have simply had more time to partake in unsuccessful risky behavior, which may have resulted in injury or death. This, however, does put the aging psychopath firmly into the endangered species category. It's almost like National Geographic, but with fewer cute animals and more scary men. An important distinction here is that the personality traits don't just disappear, it's simply the behavior that changes. This is also exactly what we're trying to manipulate with risk management, but instead, we're trying to avoid the death or disability part because that sounds like it's probably unpleasant. Basically, we're intervening and preventing people from taking part in the behavior despite their drive to do so. Think of it like someone who likes pineapple on pizza. Very sick and unwell individuals. Those fundamentally incorrect processes that clearly take place in their brain cannot be changed, but we, as the good public body, can try to mitigate their participation in eating that. So you may be asking yourself, why risk management? Why not just treatment? Well, that's because there is none, at the moment at least. This isn't from lack of trying, however, with many different forms being tested over the years, most notably in the 60s and 70s in Ontario, where they gave patients LSD as a treatment. The thought was that it would break down psychological defenses and give them emotion, but in a very shocking turn of events, giving copious amounts of hallucinogens to psychiatric patients did not go well. And it actually led to worse long term outcomes, including higher recidivism rates. Thankfully, we've looked to more humane approaches in recent years, such as CBT, but there still is no established treatment shown to be effective for psychopathy, which highlights exactly why risk management is so important. In risk management, we want to change the environment to limit the triggers and opportunities for criminal behaviors, and focus on behavior management to create more agency within that person. In psychopathy, offending is a choice, but risk taking, impulsivity, and lack of empathy make harmful choices more likely. The best framework to look at management under is the risk needs responsivity model. This focuses on responding to a person's risk level, their individual criminogenic needs, and their responsivity to treatment. In terms of risk level, this means exactly what it sounds like. Someone with higher risk will need more intervention than a lower risk individual. Criminogenic need refers to attending to the factors that make someone more likely to reoffend. This could mean getting them into a substance abuse treatment program, finding them stable employment, or having them take anger management classes. Finally, responsivity means tailoring the intervention to the individual in terms of learning style and ability, as well as motivations. However, because the majority of people with psychopathy don't exactly want to change, it makes management a little more difficult. Because of this, one of the most common strategies is monitoring and supervision. This means someone like a social worker will drop by to see how they're doing, keeps tabs on their behavior, and monitors the ongoing changes. This last point is crucial because although the disorder is static, that doesn't mean that the risk factors are. Risk factors will change over time, either for better or for worse, but they're always dynamic and need to be constantly reevaluated as such. Another strategy is limiting their exposure to high risk situations. This involves things like not allowing access to substances, firearms, or being best friends with all the local drug dealers. The final strategy, which is arguably the most proactive rather than reactive, is skill building and routine structuring. This includes working on building skills like problem solving and developing strategies to aid in controlling behavioral impulses. Routine structuring also limits free time and generally avoids those blocks where impulsivity might get the best of them. In conclusion, for this very rapid explanation, Psychopathy doesn't change much, treatment options are basically non existent, but risk management lets us target the behaviors that do actually matter. Through supervision, environmental structuring, and skill building, we can work to reduce that harm. If you're curious about the details, feel free to check out my paper once it's done. It's all in there, minus the bad jokes.